Hi, everybody. This video is going to be levator scapula. So levator scapula is a muscle that attaches to the scapula. Obviously, it's in its name, but it also attaches to the neck, so the cervical vertebrae. Levator scapula is going to be a little bit unique in this unit because it's really the only one that's going to be moving the neck. So let's take a look. All right, here we are. Page 83, actually, yeah, 83. It's 83 and 84. Let's bring this up a little bit bigger here. So levator scapula is one of those muscles that is kind of the odd man out, especially in this unit. It does attach to the scapula and it does move the scapula, but since it also has attachments on the cervical vertebrae, it is going to move the neck. So this time we are going to have bilateral, unilateral actions. We're going to have cervical actions and scapular actions. The muscle itself is fairly wide, about 2 fingers wide. But it is sandwiched in the neck area in between a couple of other muscles that we won't really get to until we study the neck, which is in another chapter altogether. So for right now, when we palpate this one, it's really important to understand that levator scapula in the cervical area here can be distinguished from the other neck muscles because it's the only one that's going to affect the scapula. The other muscles in this area are only going to move the neck. So let's take a look at those. I think those are on the next page here, and they are. Yeah. Okay, so it's levator scapulus here. So it's sandwiched between splenius capitis and posterior scalene, or the scalenes. Levator scapula looks big, and it looks like, oh yeah, you should be able to just touch it, and there's plenty there to feel. It's really not true. You know, these drawings are ambitious, let's just say. When you actually feel somebody's neck, there's so much in here and it is really so close together that sometimes it's very difficult to pick out levator scapula. But if you remember what I just said, it should make it a lot easier. The levator scapula is the only muscle here in the neck that is going to affect the scapula. Splenius capitis, scalenes, they're not going to affect the scapula at all. Okay, they don't attach to the scapula, they have nothing to do with it. So this is the only one that's going to. So we're going to try to palpate this by action in class. All right, so let's take a look at this. Origins and insertions. So the origin are the transverse processes of C1 to C4. Transverse processes of C1 to C4. And if you are like me and don't like all the words, the verbiage kind of gets in your head, you can do TPs of C1 to C4. Okay, TPs C1 to C4. As long as you know what that means, you're fine. You don't have to handwrite out transverse processes of 1st through 4th cervical vertebrae. It gets heavy. So TPs C1 to C4 is fine. Okay, now as far as the insertion is concerned, it has to describe this little part right here. So we're really looking at the superior angle of the scapula. But we also have a little bit of the medial border of the scapula. So that's what this says. Medial border of the scapula between the superior angle and the superior portion of the spine of the scapula. Okay. Superior angle, got that part. Medial border, okay, between the superior angle and the spine of the scapula. Okay. If you remember superior angle, I think you'll be fine, because that's really the only part that we're going to be able to palpate there, because it gets very crunchy. I'm not sure if you felt this on your partner yet, but right around the superior angle of the scapula, if you use your thumb or your fingers, it feels really crunchy, like you go bump, 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 or you go crunch, 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 or something like that. That's going to be the insertion of levator scapula. You can't miss it. So as far as the actions are concerned, we just mentioned that it affects the scapula. So yes, obviously, unilaterally, so one side at a time. Remember, one side contracts, we have unilateral actions. We have 2 for the scapula and 2 for the neck. Levator scapula elevates the scapula. It's levator, elevator, and brings it up. See, it's in the name. Levator scapula elevates the scapula and downwardly rotates the scapula. Okay, and really that's just because of the position of it right here. It's actually going to pull right from here to here. Okay, so if that happens, it's going to pull this section towards the spine, which is going to take the acromion towards the floor. All right, so what else do we have? So we have elevation and downward rotation of the scapula. And then as far as the neck is concerned, laterally flex the neck. Sure. Yep, one side contracts, the head and neck goes to that side. Okay, that's easy. Rotates the head and neck to the same side. Okay, so levator scapula is an ipsilateral rotator. Remember that word, ipsilateral. Ipsilateral means to the same side. Remember trapezius, which is this one right here, of course, that is a contralateral rotator. So levator scapula rotates the head and neck to the same side. What that means, of course, is that if the right side levator scapula contracts or shortens, then the whole head and neck is going to the right side. If the left side levator scapula shortens, the whole head and neck is going to the left side, okay? The bilateral action of levator scapula is extending the head and neck, just like trapezius. If both contract at the same time, I'm going to pull the head and neck into extension. Levator scapula is one of those muscles that causes problems for a lot of people because of its rotation action and because of its elevation action. A while back, people used to hold their phones between their neck and their shoulder when they were talking on the phone and they needed their hands to be free. Now, of course, we have little earbuds and we don't have to do that, which is brilliant. But we still use levator scapula quite a lot. And this sort of illustrates some of the ways in which levator scapula is used. So for one, changing lanes. When you're on a highway or you're changing lanes and you're merging or something like that, you have to turn and look over your shoulder. Obviously, you look in your mirror too, but you're supposed to turn and look over your shoulder. That's levator scapula, okay? Scratching your ear with your shoulder. I don't really know who does that, but let's say you do. That would be levator scapula. Lying on your side, snuggling your head into your pillow, like that. Okay, but here's the problem. Laying on your side, snuggling your head into your pillow actually causes problems with levator scapula. I can't tell you how many clients I have worked on who said, I don't know what I did, but I think I slept wrong. And now I can't turn my head. I've heard that a lot. Sleeping wrong is a cause of people seeking massage therapy because now they can't turn their head, they can't flex their neck or laterally flex their neck. So anyway, you're going to work on levator scapula quite a bit, just to let you know. So in class, we will figure out exactly which of these neck muscles is levator scapula during palpation. All right, that's it for levator scapula. Have a nice day.